Appendicitis. An explosion of fun. Appendicitis is a pretty great subject. It is a inflammation of your appendix, which is a little bitty notch down in the bottom of your intestines. We can't seem to find a use for it, but it's there, and it tends to lead us to the hospital every once in a while. Okay, to demonstrate my point here about the appendix, I'm going to be operating on my cat and showing you exactly where the appendix is. 1 second. Here we got a common feline. It's a male, but I'm going to show you how the intestines are going to start about right here. And obviously I didn't sedate the patient yet, but the colon starts around here, and we're going to have the appendix right about here. So we're going to be going in well, the patient escaped, but you kind of get the gist of where the appendix is and how to get to it. We'll have to make about a 2 millimeter incision at around the navel spot of the feline, and we'll just remove that sucker. The appendix, it looks like a chewed little piece of bubble gum right here that hangs off the end of your intestine there. This is what it looks like when it's inflamed as opposed to normally, which looks a little less like bubble gum. Okay, the first symptom is stomach pain, followed by chills, fever, shaking, or diarrhea. Ouch! There's a really good example of an inflamed appendix. It looks really delicious, actually. I was about to eat some sausage, and I don't know if I want to anymore after this. But see, right here, this is what we have. I actually have had my appendix taken out. It was a pretty good time. They went in through my belly button and I guess pulled it out or chopped it up, whatever they do, but they didn't offer to give it to me or anything, so I imagine that it's in some kind of jar somewhere in a lab. Here's a little example. I drew a little picture of what it felt like. And this was like 5 years ago. Yeah. So I don't know if I was wearing glasses then, but I try to do my best to think that far back. There are many complications that can occur. Rupturing of the appendix is one of the worst. Using a CT scan to detect appendicitis will help you on your way to having the useless piece of flesh removed. And that's the end of the presentation. I hope you enjoyed it. I hope you liked the space theme, because it had so much to do with that, but there wasn't a medical theme, so I had to make do.